Are you extremely anxious, fearful, or panicky? Do you always worry too much? Are you fearful of things you know you shouldn't be that afraid of and find that you go out of your way to avoid them? Do you have obsessions or compulsions? Responding to danger skillfully is probably the most basic survival skill. Fear is a gift that allows us to survive in an often dangerous world. But if you have fear that occurs for no reason at all, or fear out of all proportion to any realistic danger, you may be suffering from an anxiety disorder. The experience of anxiety occurs just as much in the body as in the mind. Your heart races, you may become sweaty, tremble, short of breath, feel like you're choking, dizzy, or sick to your stomach. You might have generalized anxiety if you seem to feel anxious, nervous, and worried almost all of the time. In panic disorder, anxiety occurs in explosive attacks called panic attacks that seem to occur out of the blue and repeatedly. This is sometimes associated with agoraphobia, which is the fear of going to places where you feel that you might not be able to escape. Social anxiety is a fear of social or performance situations. Other specific phobias include situations like flying, insects, seeing blood, and numerous other circumstances. With obsessive-compulsive disorder, you might experience thoughts that are extremely disturbing and anxiety-provoking, and that you try desperately to control. These thoughts can feel like they're not part of your usual self, or what you normally think about. Compulsions are the behaviors or rituals that can go hand in hand with the obsessional thoughts. You may become a slave to rituals and compulsions that significantly interfere with your daily life. Each individual with an anxiety disorder has unique characteristics and should be thoroughly assessed. Every person suffering from an anxiety disorder would benefit from connecting with a skilled psychotherapist. Psychotherapy Matters makes it easier for you to search for a local therapist in your community. Psychotherapy Matters Virtual Clinic allows the patient, psychotherapist, primary care physician, and psychiatrist to work collaboratively.